So I want you to picture this. You're standing on the jagged volcanic shores of the Galapagos Islands, and the sun is just beating down.
Oh, set of the scene, I like it.
Right. And stretched out across these dark lava rocks are just hundreds of marine iguanas. I mean, they look like these tiny dragons, kind of like something straight out of a prehistoric myth.
They really do.
But, what makes these creatures truly mind-blowing isn't how they look. It's actually what they do when their food supply completely dries up.
Yeah, this is fascinating.
Because when these iguanas face severe starvation, they don't just burn through fat stores or, lose muscle mass. They literally shrink their skeletons.
Wait, they're actual bones?
Yes.
Yeah.
Their actual bones become shorter and smaller. It's a way to reduce their body's energy requirements so they can survive.
I mean, it is just a stunning physical adaptation to an environment of total scarcity. Like, we can actually observe and measure this evolutionary response happening in real time.
Exactly. And that brings us to the core of today's deep dive. Because human beings are going through a physical adaptation of our own, but it's happening under the exact opposite conditions.
Right, in a time of plenty.
Yeah, in an era of absolute abundance, we are shrinking our own skeletons. Specifically, the bones in our human faces and our jaws, they're getting smaller.
And this anatomical shrinking is, well, it's quietly driving this massive epidemic of crowded teeth, severe sleep disorders, and even life-threatening cardiovascular diseases.
Okay, let's unpack this, because our mission today is to explore this profound blind spot in modern healthcare.
Yeah, the complete artificial separation of dentistry and medicine.
Exactly. We have a great source today, Dr. Maria Sokolina's book, Breathless, A Medical Mystery of the Hidden Epidemic. We're going to look at the medical reality of a specific family, Eugene, his wife Olga, and their daughter Zoe.
Because their journey really reveals this terrifying hidden link between the shape of your face, how you breathe at night, and, well, sudden cardiac arrest.
I keep thinking about the human body like a house.
What do you mean?
Well, it feels like modern dentists are sort of standing on the front porch, right? They're meticulously painting the front door, making sure the trim looks perfect.
Right, getting the smile perfect.
Yeah. And meanwhile, the medical doctors are down in the basement, strictly monitoring the plumbing and the electrical panel.
The heart and the vessels.
Exactly. But nobody is stepping back into the yard to realize that the concrete foundation of the house itself is actively shrinking.
And, that lack of communication between the disciplines has devastating consequences. I mean, to see how this plays out, we really have to look at what happens to Eugene.
Yeah, so Eugene is 42 years old, and he's running a tech startup.
By every modern standard, he appears to be a highly functioning, active, relatively young guy, right?
Totally. I mean, he plays tennis, he's building a company, but then we hit this terrifying, inciting incident. It's just a completely normal morning.
Right.
His wife Olga is in the bedroom getting ready for the day, and suddenly she hears this heavy thud from the kitchen. She runs in and finds Eugene collapsed on the floor. His body is twisted, his lips are turning blue, and he is just not breathing.
He had gone into ventricular fibrillation, which is sudden cardiac arrest.
And that's usually fatal, isn't it?
Unfortunately, yes. The survival rate for out-of-hospital ventricular fibrillation is incredibly low. I mean, his heart wasn't just beating abnormally. The electrical signals were misfiring so badly that the heart muscle was just quivering chaotically.
So it's not pumping anything.
Exactly. It completely failed to pump oxygenated blood to his brain or his vital organs.
But Olga, she just jumps in and starts doing chest compressions, and the paramedics arrive, and they literally have to deploy a defibrillator right there on the kitchen tiles to shock his heart back into a functional rhythm.
And miraculously, they managed to get a pulse.
Right. But his battle is really just starting, right? Because the immediate medical concern pivots from his heart over to his brain.
Yeah, because when someone's brain is deprived of oxygen for that long, the resulting tissue damage and the swelling can just be fatal even if the heart is restarted.
So what do they do?
Well, at the hospital, the medical team initiates what's called therapeutic hypothermia. They actively cool his core body temperature down for a couple of days to drastically slow his brain's metabolism.
So they are essentially putting him on ice to buy the brain time to heal without swelling.
Yeah, along with inducing a medical coma. It's a highly aggressive protocol to protect his neurological function.
And amazingly, it works. He actually survives.
Right.
But as Olga is sitting there in the intensive care unit, watching all these monitors, she starts doing what anyone would do in that situation.
Looking for clues.
Exactly. She starts reviewing the tape of the last few years, looking for the warning signs, and she realizes there was a massive trail of clues that everyone, including his doctors, just brushed off.
Because the symptoms were really hiding in plain sight.
Yeah, like Eugene was constantly falling asleep at his desk. He was consuming massive amounts of coffee and fast food just to keep his eyes open during the day.
He was having these strange cognitive lapses too, right?
Right. He forgot about his daughter Zoe's dance recital entirely. He would tell the same story 3 times in a single conversation.
And we can't forget the snoring.
Oh, yeah. His snoring was so incredibly loud and disruptive that he and Olga had actually been forced to sleep in separate bedrooms.
The medical establishment's reaction to these symptoms prior to his cardiac arrest is incredibly telling about our current healthcare system.
That's what I don't get. Why do doctors look at a young 42-year-old guy who is falling asleep at the wheel and forgetting his own life and just tell him, hey man, you've got startup fatigue, try eat a little better, lose 10 pounds, and cut your stress?
It's so dismissive.
It is. How does a medical professional look at that cluster of symptoms and not search for a systemic biological failure?
Well, it really comes down to a symptom-based approach to medicine. I mean, exhaustion is highly normalized in our culture. Doctors often treat chronic fatigue as a lifestyle issue or a psychological burden rather than a physiological alarm bell.
That's so true.
If we connect this to the bigger picture, to find the real culprit behind why a healthy 42-year-old heart abruptly stops working, we can't look at his waking hours at the tech startup. We have to look at what is happening to his physiology when he is completely unconscious.
And we discovered the answer to that pretty quickly. Because after Eugene wakes up from the coma, the cardiologists implant a device in his chest called an ICD, an implantable cardioverter defibrillator.
Right, it's essentially a permanent internal safety net.
Yeah. If his heart ever goes into that chaotic, lethal rhythm again, the device will automatically detect it and deliver a massive shock to reset the heart.
It's an incredible piece of technology, but it also provides a continuous data log of his heart's activity.
And the data from that log is wild because the device keeps firing. It keeps having to shock Eugene's heart back into a normal rhythm.
And the timing of those shocks is crucial.
Right, it is happening almost exclusively in the early morning hours while he is fast asleep.
Yeah, this specific timing is the key. The cardiologist and a sleep specialist review this data, and they connect those early morning arrhythmias to a severe case of obstructive sleep apnea, or OSA.
Okay, this is where we need to get into the actual biology of this. Walk me through the mechanism here. How does a breathing problem while you are sleeping translate into your heart's electrical system failing?
Sure. It all revolves around the architecture of human sleep. So in the early morning hours, your body naturally cycles into prolonged periods of REM sleep rapid eye movement.
That's when we dream, right?
Exactly. And during the REM stage, your brain essentially paralyzes your voluntary muscles so you don't physically act out those dreams and injure yourself.
Right.
This means your muscle tone is at its absolute lowest, most relaxed state.
Which includes the muscles in your throat and airway.
Precisely. So for someone like Eugene, whose airway is already compromised, that extreme muscle relaxation means the airway completely collapses.
Just closes right up.
Yeah, it acts like a wet paper straw collapsing in on itself. He physically cannot inhale, so his blood oxygen levels start to plummet.
And the brain panics.
Oh, absolutely. The brain registers that it is suffocating and triggers a massive primitive survival response. It dumps a huge surge of adrenaline into the bloodstream to shock the body into waking up just enough to gasp for air.
I keep picturing someone trying to run a marathon, but like every few minutes, someone violently pinches their nose and mouth shut. The body is just desperately fighting for its life.
That's a great analogy, and every time that adrenaline floods the system, the blood pressure spikes dramatically.
Yeah, the heart is taking a beating.
A massive beating. Imagine subjecting your heart to that violent stress cycle 30, 40, or 50 times an hour every single night.
Wow.
That immense repetitive mechanical and chemical stress is what damages the heart muscle and eventually causes its delicate electrical rhythm to become unstable and just fail.
There is a terrifying statistic from the medical research that really drove this home for me. Patients whose oxygen drops below 78% at night have more than double the risk of sudden cardiac death.
Double the risk.
Yeah, and that holds true even if they have absolutely zero prior history of heart disease. The sleep apnea itself is the loaded gun.
So we've established the mechanism stopping his heart. But now we need to introduce the dental perspective.
Yeah.
Why is Eugene's airway collapsing so easily in the first place?
Hold on, I want to challenge this transition for a second. We are jumping from a life-threatening cardiac event to his dental history.
I know, it sounds like a stretch.
It does. I mean, I know from his medical file that Eugene had 4 healthy teeth extracted when he was a teenager to make room for braces, but I actually had the exact same thing done when I was 14. Are we really claiming that a standard orthodontic procedure performed on a teenager set him up for a heart attack 3 decades later?
I get it, that feels like a massive, almost irresponsible leap to make.
Yeah, exactly.
But it actually sounds unbelievable until you look at the underlying anatomical domino effect.
Mm.
Dentists like Dr. Sokolina, who specialize in airway health, see a highly specific pattern in their chairs every single day.
What kind of pattern?
Patients who present with severe sleep apnea, intense nighttime teeth grinding, and temporomandibular joint disorders, TMJ. They almost universally share a specific facial architecture. They have narrow, highly vaulted palates, and very often they had teeth extracted for orthodontics in their youth.
Okay, break down the connection for me. How does taking teeth out shrink the airway?
To understand that, we actually have to zoom out to the evolutionary scale.
Okay.
For hundreds of thousands of years, our ancestors ate incredibly tough diets. Raw meat, fibrous roots, things that required immense mechanical force to break down.
Lots of chewing.
Right, constant heavy chewing. And that provided mechanical stress that stimulated osteogenesis, or bone growth, in the jaw.
But today, I mean, we live on a completely soft diet. We eat purees, cooked vegetables, soft breads, and highly processed foods.
Exactly. We barely chew our food at all compared to our ancestors.
So our bones react to that.
Yes. Because of that lack of mechanical stress, modern humans are simply growing smaller facial bones. Our jaws are physically shrinking. But here's the critical anatomical mismatch. The human tongue has not changed size.
Oh, wow.
It is the exact same size it was 100,000 years ago.
Okay, I have an analogy for this. It's like buying a plush king-size mattress but trying to stuff it into a twin-size bed frame.
That's exactly it.
You can force it in there, but it is going to severely bulge out over the sides. In our mouths, if the bed frame is too small, that large muscular bulge of the tongue has nowhere to go but backward.
Here's where it gets really interesting. Directly behind the base of the tongue is the windpipe.
Right.
So when an orthodontist pulls healthy teeth to fix crowding, they are taking an already underdeveloped jaw and intentionally shrinking the arch even further just to make the remaining teeth align cosmetically.
So the front door looks aesthetically perfect, but the foundation of the house just got smaller.
Exactly. The tongue is forced even further back, crowding the airway.
It forces us to ask a really uncomfortable question about modern dentistry. By focusing so heavily on cosmetic alignment and straight smiles, have we inadvertently been suffocating people decades later?
It is a profound realization. And, once that airway architecture is compromised, finding a treatment that actually works becomes a complete labyrinth.
Because Eugene's experience with the standard treatments is just brutal. I mean, he is prescribed a CPAP machine, which is considered the gold standard for sleep apnea, right?
Yes, the continuous positive airway pressure machine.
It's essentially an air pump that forces pressurized air down the throat to physically prop the airway open, but he is absolutely miserable using it.
Patients often describe it as a relentless, dry hurricane blowing into their face where they're trying to sleep.
He tries the little nasal pillows. He tries the full face mask that makes him look like a fighter pilot. He feels claustrophobic. His skin is irritated, and he feels like he is choking on the air pressure.
It's awful for him.
He literally rips it off his face in the middle of the night, telling Olga he would rather die than wear the machine for the rest of his life.
Well, the frustration stems from the fact that CPAP is attempting to use air pressure to force its way through a structure that is fundamentally blocked on multiple levels.
Right.
Eugene consults with an ear, nose, and throat specialist, Dr. Chernobylsky, who explains that the airway collapse is a team effort. The obstruction can happen at the nose, the soft palate, the tonsils, or the base of the tongue.
And Eugene has issues at every single one of those checkpoints.
He really does.
He has a deviated septum. His nasal turbinates are severely enlarged. I actually had to look this up. Turbinates are these little bony, fleshy ridges inside your nasal cavity that are supposed to warm and filter the air you breathe.
Right, but they can cause big problems.
Yeah, when they get inflamed and swell up, they physically block the nasal passage. Add that to his shrinking jaw, and he has become a chronic mouth breather, which only makes the airway more unstable.
Historically, the surgical options to fix this anatomy were quite brutal. The old standard was a procedure called UPP, uvulopultopharyngoplasty,
Which is a terrifying word to look at.
and a terrifying procedure, frankly.
Yeah.
A surgeon would take a scalpel and aggressively slice away the uvula and large sections of tissue from the soft palate and throat.
Just cutting it all out.
Yeah, and it was agonizingly painful, the recovery was horrific, and because it often created stiff scar tissue, it frequently failed to actually cure the sleep apnea.
Thankfully, modern surgical methods are far more sophisticated, right?
Much more. We now have hypoglossal nerve stimulation, which acts like a pacemaker implanted in the chest that zaps the tongue nerve to move it forward during sleep. There are also intense surgeries that physically cut and advance the jaw bones forward.
But before attempting massive reconstructive surgery, Olga and Dr. Sokolina pursue a non-invasive dental solution. They decide to address the architecture of the mouth to relieve the burden on the heart.
Right, what's fascinating here is how simple the device actually is. Dr. Sokolina fabricates a custom mandibular advancement device.
It looks a bit like a sports mouthguard, doesn't it?
Somewhat, but it is highly calibrated. It gently holds Eugene's lower jaw in a slightly forward position while he sleeps.
And that makes room for the tongue.
Yes. By pulling the lower jaw forward, it physically pulls the heavy base of the tongue away from the back of the throat. That prevents it from collapsing into the windpipe when his muscles relax during REM sleep.
They also pair this physical appliance with mouth taping, which sounds crazy, but he literally puts a small piece of specialized, porous medical tape over his lips before going to sleep.
It's incredibly effective, though.
Yeah, because it forces his body to abandon the mouth breathing habit. It retrains him to breathe exclusively through his nose, which naturally filters, warms, and pressurizes the air, keeping the airway way more stable.
They're restoring the natural mechanical function of breathing, rather than just blasting air into a collapsed tube.
But just as Eugene's cardiovascular crisis starts to stabilize, the family faces another terrifying medical puzzle. And this is where the generational aspect of this deep dive becomes so crucial.
It really is.
Because they start looking really closely at their 8-year-old daughter, Zoe.
Zoe is exhibiting severe behavioral issues.
She is struggling intensely at school. She interrupts her teachers constantly. She cannot regulate her emotions, and she hyper-focuses on activities she likes, but has zero attention span for anything else.
Which leads to a very common recommendation.
Yeah, the school administration is heavily pressuring the parents to get an ADHD evaluation. They have essentially labeled this 8-year-old as a permanent disruptor who needs stimulant medication.
But Olga is now viewing the world through the lens of airway health, thanks to what happened with Eugene. So she takes a step back and starts observing Zoe's habits at home.
She notices Zoe is still wetting the bed at age 8. She sees Zoe sleeping in these incredibly strange contortions, like propped up on her knees and elbows with her face pushed into the mattress.
And most importantly, she realizes Zoe is breathing heavily through an open mouth all night long.
Right, so they bring in a pediatric sleep specialist, Dr. Funke Brown, and conduct a home sleep study on the 8-year-old.
And the data from that study reveals that Zoe has an apnea-hypopnea index, or AHI, of 6. This means she is experiencing 6 distinct breathing disruptions every single hour she is asleep.
To put that in perspective, if an adult has an AHI under 5, the medical field technically classifies that as normal.
But children are entirely different. I mean, their brains and nervous systems are developing at an explosive rate. In a pediatric sleep study, anything over an AHI of 1 is considered clinically abnormal.
So an AHI of 6 is really bad.
Yes. Zoe is suffering from moderate obstructive sleep apnea. She is suffocating 6 times an hour.
And this totally reframes her behavior at school. There is a fascinating physiological difference between how adults and children process chronic sleep deprivation.
It's complete opposites.
Right, because when adults are exhausted, our systems power down, we get sluggish, and we fall asleep at our computers like Eugene did. But a child's nervous system reacts differently to the threat of suffocation.
Yeah, children do not show exhaustion by slowing down because their airway is constantly threatening to collapse. Their bodies pump them full of adrenaline and cortisol to keep their brains hyper-aroused so they don't stop breathing.
They become hyperactive, they become impulsive, they lose their ability to focus because their brain is trapped in a permanent fight-or-flight survival loop.
And the symptoms of childhood sleep apnea perfectly mimic the symptoms of ADHD.
So what does this all mean? How many kids are sitting in classrooms right now, labeled as problem children and being medicated with heavy amphetamines, when the reality is their brains are simply starving for oxygen every night?
It is a staggering public health question. If medical professionals are misdiagnosing anatomical airway collapse as a psychiatric or behavioral disorder, we are merely medicating the fire alarm instead of actually putting out the fire.
And because they caught this early with Zoe, the treatment pathway doesn't involve Ritalin, and it doesn't involve immediate surgery to rip out her tonsils.
No, they utilize an orthodontic technique called arch expansion.
How does that work?
Well, because Zoe's facial bones are still malleable and growing, a specialized orthodontist uses an appliance to gently widen her palate over time. They are actively building that king-size bed frame we talked about earlier to ensure her tongue has the proper amount of room to rest against the roof of her mouth.
And they combine that structural expansion with myofunctional therapy. I love this concept, by the way. It is essentially physical therapy, but for your face and tongue.
Yeah, they give her exercises like tongue push-ups and swallowing drills to strengthen the airway muscles and retrain the tongue to stay out of the throat.
By fixing the root anatomical issue now, they are stopping the domino effect before it ever has a chance to crush her heart the way it did her father's.
It perfectly illustrates why proactive structural intervention is vastly superior to reactive symptom management.
This has been such an incredible web to untangle. I mean, we started with a tech executive collapsing on his kitchen floor from a legal heart rhythm. We traced that electrical failure back to his paralyzed airway during REM sleep.
And then we followed the collapsing airway back to his shrunken jaw and extracted teenage teeth.
Right. And we watched that exact same anatomical flaw manifest as severe behavioral issues in his young daughter. It proves, beyond any shadow of a doubt, that the mouth and the cardiovascular system cannot be treated as two isolated ecosystems.
The overarching takeaway for you listening right now is a complete paradigm shift in how we view daily fatigue. We have deeply normalized physiological dysfunction.
We really have.
We accept chronic snoring as a quirky, annoying habit. We accept waking up exhausted as the unavoidable price of living in the modern world. We see our children sleeping with their mouths hanging open or acting impulsively, and we immediately look for behavioral band-aids.
But this discussion proves that you need to re-examine your sleep, your morning brain fog, and the way your family breathes. These are not normal quirks. They are urgent, vital indicators of your systemic health.
Because if you allow the foundation to slowly crumble, it doesn't matter how nice the front door looks.
Yeah.
The house will eventually fall.
Exactly. And that leads me to a final, slightly chilling evolutionary thought to leave you with. If our modern environment, our endlessly soft diets, our chronic psychological stress, and our sedentary indoor lives is literally changing the skeletal structure of the human face in the span of just a few generations, what on earth is the human face going to look like 100 years from now?
Scary thought.
Are we rapidly evolving into a species that fundamentally requires a pressurized machine strapped to our faces just to survive the night? We look at those marine iguanas in the Galapagos, marveling at how they shrink their bones to survive their harsh reality. But maybe we don't need to travel to the Galapagos to see evolution in action. Maybe we just need to look in the mirror.